follow-up. Republican Senator John Barrasso joins us live. Senator Barrasso is also an orthopedic surgeon. During the break, he told me he saw a patient over the weekend back home.
Great guy. World War II. He actually drove for Eisenhower, broke his hip. Ted Lee in Casper, Wyoming. He's doing well in the hospital.
Great. Well, that's good news. All right, now back here to Washington. Big loss for the Republicans. They had hoped that this Cadillac Social Security issue in the Cadillac tax would get rid of the entire reconciliation bill. You lost that with the parliamentarian today.
And is it a surprise? Because the parliamentarian, of course, works for Harry Reid. So
what do you mean he works for him?
Well, he is the parliamentarian in the Senate is hired by the majority leader. Harry Reid hired him, and that's who he works for. He reports to him, gets his paycheck through the Senate, through Harry Reid's office. And if you take a look at how it ought to really play out, they should have rejected the reconciliation bill based on this, because it does rob Social Security money.
You're the first one to say that basically the fix is in with him, because everyone else has come in here and I've talked to has said the parliamentarian's a pretty straight guy.
He's a pretty straight guy, but that's who he works for. So you draw your own conclusions, because this ruling, I think, should have gone the other way.
So now what do you do?
Well, we're going to continue to go. It looks like tomorrow the president's going to sign this horrible bill into law, and then the Senate is going to try to pass reconciliation, which takes a bad bill and makes it much worse, because reconciliation actually increases taxes more, Greta, and it cuts Medicare more, and it dumps more people onto Medicaid, a program that already isn't working at all. So all of the things in reconciliation, there's still all these sweetheart deals. We are going to go through the whole reconciliation debate process, and then we're going to bring a series of amendments so the American people know exactly what's in this bill. The American people are disgusted with what they saw, with the way the votes have gone, with the bullying and the bribery and the bought votes.
Well, let me ask you about that, because one of the things is, and I should say one thing, though, the reconciliation bill at least gets rid of the Cornhusker deal or whatever.
But it keeps the Louisiana Purchase in. There's a lot of things that are still in there.
All right, but at least that one was sort of struck a nerve with everyone. All right, Congressman Stupak, who was holding strong until Saturday, and now he says he's satisfied based on an executive order that the president has signed. On Friday, there was a press release that his district got $726,000 in aid from the federal government. Coincidence, bad timing, or, I would think that you guys could figure this timing out a little bit better than that.
You would think they could. There's that one. There's the Tennessee extra $100 million for a hospital in Tennessee for a member that's retiring for his district. I mean, there are a number of these additional sweetheart deals jammed into this bill, Greta.
Are they tied to getting the person's vote? Because there's a little bit different than whether, a district would get the money or needs some money, or whether or not it's simply to get the vote and the congressman or senator gives up the vote for that.
Well, what a coincidence. And just in Utah, a member that Utah who voted on the bill, he was against it, then he was for it, and what a coincidence that his brother just got named to be a federal judge. How do you make those decisions? The American people are going to make that decision come election day. And that's why, as a doctor trying to talk to my patients, I'd say, let's be honest. What's happened right now is taxes are going to go up, Medicare is going to get cut, it's going to be harder to get care, insurance premiums are going to get up, and we're going to be through some tough times, but it'll get better because we'll be back in charge as a result of the American people rising up and saying enough.
How does the care change?
Well, I think it's going to be, you hear about a number of doctors that say they're going to retire. Look what's happened in Massachusetts.
Why are they retiring, though? Are they not getting paid? Is it because we haven't given them the doctor fix? I mean, why don't they want to still be doctors?
Well, part of this, when they say there's going to actually save money, they're going to cut doctors' fees by 21% for Medicare and keep them frozen for the next 10 years. That's one of the ways it works. Doctors say, I just don't want to be under government-run health care.
Because I think that's what really worries people most who are opposed to it. Is that people, they worry about their health. They want doctors to take care of them, and that's the thing. We say, raise tax. Okay, well, the people hate spending more money, but fundamentally it's the care issue.
Massachusetts, it's kind of the model for this plan. It's now 42 days wait to see a doctor. 42 days wait, and it's a result of the bill that passed in Massachusetts, which is completely making it harder for people to pay their bills because the insurance premiums are the highest in the country in Massachusetts, and is breaking the state.
Senator, thank you, sir.